32%.
That's wonderful. I will say that when we do this in person, we give we allow participants at least 30 minutes to talk about their frustrations with treatment planning, because I think as clinicians we've all shared a number of frustrations.
Oh, sorry.
So what I'd like to talk a little bit now is defining what treatment planning is. And as I go through this, please think about how your agency views treatment planning and what their philosophy might be. So this is basically the what, who, when, how, and why of treatment planning. The treatment plan is a pivotal point which all other documentation activities revolve. The plan is like the hub of a wheel. Without that hub, nothing hangs together. The spokes have no way to connect. The spokes of the wheel make up the flow of the clinical record process. With the treatment plan being the center of the wheel, each of the components interconnects to function as the client's continuum care plan. So we'll talk a little bit, and I have had some feedback from participants that this is really helpful, as particularly to describe when it is appropriate to have program-driven plans, as I'll define a bit later, and individualized plans. So if we look at the clinical process, when oftentimes when clients approach the substance use disorder system, they get there by what means of a screening tool of some sort. Many are standardized. And the other part of that screening is also determining the appropriate level of care, an example here being ASAM. And from there, typically